Hi, Dr. Travis Rose here from Peak Form Health Center, and today I'm going to talk to you about how to manage tension type headaches at home using a lacrosse ball, doing self-myofascial techniques at home. So we usually go through a full evaluation with our patients, and we'll try to determine if the patient's experiencing their headaches due to tight musculature, or if it's restriction from the joints, or there are other causes of their headaches. Now, if we find that the muscles are a primary source of their headache symptoms, then we'll prescribe these exercises so that they can do it on a daily basis to help minimize the symptoms while at home and in between appointments. So the areas that are common culprits, and it's different for each person, but common areas that get really tight and will refer headache symptoms are going to be the musculature that runs from the top of the shoulder blade area all the way up into the neck towards the base of the skull here. And the other area is going to be right along the neck, going down into the mid-back area, that there's a lot of knots that will develop trigger points, and that can send headache type symptoms up towards the back of the head. So what we want to do is get a lacrosse ball, and I always recommend doing this drill against the wall because you can really vary the pressure that you're using versus trying to do it on the ground with a really hard ball like this, because then it's so pokey or so painful that you can't relax into the exercise. And you want to stay relaxed, because if you're fighting it the whole time, you're not going to release much muscle tension. So what you want to do is come up to a bare piece of wall, place the ball next to the spine, not on the spine, and just let it rest there. And then you're going to let the ball roll down until it's about between the shoulder blade and the spine. So from there, get your hips up off the wall, and you're just going to move it around, and you're looking for tight or sore spots in the muscle. So as you move it around, you're just kind of paying attention to where you feel that tightness, tension. So I'm not feeling too much there, so I'm going to try to get the ball a little bit lower and repeat that process. Right there, I'm feeling the ball on a pretty tight spot. So what I'm going to try to do now is get the ball right on top of the tight spot, relax my arm, relax my body, and just use my feet to push into the ball. And I'm going to push as hard as I can tolerate, basically, meaning I'm going to try to generate as much tension into the tight spot as I can without tensing or holding my shoulder up. So again, you want to stay relaxed and just let the ball dig into the tissue. Hold it about 30 seconds or so. You can hold it longer if you feel like that's beneficial, but minimum 30 seconds. After 30 seconds, then you can move the ball around again, and again, just find different tight spots or try to hit the same tight spot from different angles, and that's going to release the most tension from this position here. Now, the second position that we're going to do is we're going to come up to a doorway, or you can use a hallway corner, and you're going to place the ball right onto the door jamb or the corner of the hallway there. And you're going to use this area to get into the top part of the shoulder, right into the upper trapezius muscle. And this is a common muscle that gets affected in tension type headaches, and it will refer headache symptoms to the back of the neck, back of the head, or it may even wrap around and settle down around the temple area. So if you're experiencing those symptoms, that's a tension type headache that usually comes from the upper trap musculature. So again, to demonstrate this here, we're going to open up the door, place the ball on the door jamb here, and you're going to take a wide stance, lean forward right into that musculature there. So you're going to bend forward, so when you're using the ball into that muscle, you're trying to keep the arm nice and relaxed. You're going to shift your weight through the doorway, allowing the tension to develop into the muscle. Try to stay relaxed, let the ball dig deep. Sometimes you'll experience those headache symptoms coming up towards the side of the head or into the temple area, and that's usually a sign that you're on the trigger point or the tight spot that's actually causing those types of headaches. So those are the two exercises that we find most useful for dealing with tension type headaches. Now you want to do this exercise in both those positions about 1 to 2 times a day, and spend about 1 to 3 minutes in each area. Wherever you feel those tight spots or sore spots in the musculature, try to get your weight behind the muscle, and you want to relax into it. Hold it for about 30 seconds at a time before moving on to another knot. Something that can aggravate the tissues is if you get right on top of the sore muscle or tight spot and you just sit there and just roll over it repeatedly. Sometimes that can cause some spasming of the muscle and can actually make the condition worse. So try to do long, sustained holds into those muscles and do it on a daily basis to see optimal results.